Congratulations! Your company has invested in the model OK-1000 back support belt with built-in lumbar support pad from OK-1 Safety, your partner in back protection. Our primary goal at OK-1 is to help you reduce your chances of sustaining a painful lower back injury by providing you with the best protection devices and training programs. Back support belts have long been recommended for athletes involved in all types of sports. Now, the belts are also being used by occupational athletes just like you. During the next few minutes, we'll explain how your new OK-1 back support belt works, how to properly wear and take care of your belt, and we'll detail the steps and importance of safe lifting procedures. Your back and spinal column are involved in virtually every movement your body makes. There are 33 segments in the spine called vertebrae. In between these vertebrae are discs, which act as shock absorbers for the spine. Of the 24 vertebrae that provide movement, we are most concerned with the 5 that make up the lumbar region, because most back injuries are related to this region. Your new OK-1 back support belt helps to properly align the lumbar region and aids in restricting the spine from flexing too far to the left, right, or backwards. As you lift, stand, push, or pull, your lower spine is protected by internal abdominal and back muscles, which tighten and create pressure inside the body. When these muscle groups are weak or fatigued, a greater possibility of injury exists. Think of your belt as external abdominal and back muscles. When worn properly, the belt can enhance the muscle groups by applying pressure to them. This helps your body create greater internal pressure, which reduces stress on your lower back. To get the full benefit of your OK-1 belt, proper fitting is crucial. First, center the lumbar pad in the small of your back and pull the inside belt layer over the abdomen, overlapping from left to right. Second, grip both ends of the outer belt layer and pull over the abdomen, again overlapping from left to right. The belt should feel snug and comfortable around your waist. Remember, the belt should not restrict normal breathing, and yet must be tight enough to provide adequate pressure. If your belt is equipped with optional tearaway suspenders, make sure they fit snug and not too loose. The suspenders are applied to the belt with self-gripping fasteners and can be torn away in an emergency. To keep your belt clean, it should be machine washed in cold water with mild detergent and then drip dried. Do not dry in a machine dryer. For further information on the features and benefits of your back support belt, refer to the instruction pamphlet enclosed with your belt. While an OK-1 belt is a superior tool in helping to decrease the likelihood of injuring your back, you must remember that no back support device can, by itself, prevent injury. The belt must be utilized with an overall back safety program instituted within your organization. The program should include exercise and training of proper lifting mechanics. Always remember, the use of an OK-1 back support belt does not mean you can or should lift more weight than your body could normally sustain without a belt on. Now let's talk about the most important part of any back safety program: proper lifting mechanics, or as we'll refer to them, the 6 steps of proper lifting. First, always size up the load to be handled. Look at what you are about to lift and, if necessary, move it from side to side and forward or backward to gauge the object's weight. Can you handle it safely by yourself, or do you need help? Being honest with your personal capabilities can save many problems in the future. Second, establish a firm footing to ensure the best possible balance and a stable lifting base. Stand with your feet apart at about the same width as your shoulders, with one foot slightly ahead of the other. Third, remember to keep your back as straight and upright as possible. When preparing to bend down to lift anything, keep your back perpendicular to the ground, not horizontal. Fourth, always bend at your knees, not at your waist. Slowly lower yourself using only your legs. and remember to keep your back as straight as possible all the way down. Fifth, as you begin to lift, tighten your stomach muscles and lift with your legs, not your back. Let your leg muscles do all the work. They are much stronger than your weaker back muscles. Finally, always keep the load as close as possible to your body. When you have to turn with your feet first and let your body follow. Never turn by twisting your body. To review, the 6 steps of proper lifting you should always follow are: size up the load, get a firm footing, keep your back straight and upright, bend your knees, lift with your legs, and keep the load close to your body. Also remember to follow your company's own lifting rules and regulations in addition to these 6 steps. OK-1 cares about your safety. That's why we provide back support belts to occupational athletes like you. But remember, back safety awareness does not stop at work. You should follow the same program at home or wherever you go. Your organization feels strongly enough about your well-being to provide you with an OK-1 back safety program. Now the rest is up to you.